Well, thank you very much. I mean, long-term growth depends on investment in people for productivity, investment for people in order to move forward, and also to reduce cost when it comes to what you spend. So, you know, prevention is better than cure, as we discussed earlier. In the case of Egypt, health was seen as a key priority. And it was linked to more than one initiative. So we have universal health insurance, which we started, and we also started with the World Bank and other partners, and I'll speak about that. But also we had presidential initiatives, which were very key in terms of taking care of services to be provided to different citizens across the country. And then we had a very other important presidential initiative, which is the Decent Life Initiative, and that is to provide primary care clinics and services to people across different governorates. So if we take the universal health insurance by itself, we've reached 6 governorates already, with a number of hospitals that are there, as well as beneficiaries close to 6 million. If you add that to the presidential initiative on health, we've reached 90 million people through 250 million services, including non-communicable diseases. If you take a look at the primary services clinics through Decent Life, we're talking about more than 2,000 and also reaching to different people. So the scale is quite enormous, but also what's important is the complementarity between the initiatives. We're starting the second phase of universal health insurance, which is very important to us, in 6 other governorates. And the idea of the private sector was very key. There's a new law that was passed, which is concession for health for the private sector. So it encourages private-public partnerships. It encourages cost efficiency and innovation with the private sector. The other element, which was key for the pushing all of these reforms, was also the out-of-pocket spending. And as was mentioned from the previous presenters, that is a key constraint on citizens and also adds to poverty rates. So, the whole spectrum of all these initiatives together is also to try and address that. And then finally, something that was mentioned in the Indonesian video, but also needs to be taken into account when we're looking at public finances. What we're spending on water sanitation, what we're spending on other services also adds indirectly to the bigger health spending picture. So we should not only take the universal health insurance spending by itself, but we should also integrate it with other types of spending. And this is also happening through different partnerships, be it with the World Bank, be it with other partners for the country. So and I think through the hub we will have a very good opportunity to discuss how we can look at all of these spendings, but try and see how they can be more efficient and put under one umbrella, so that really the amount that is being done from different countries is taken into account. Thank you.
Thank you so much.